Welcome to Ripple Effect Connection. I am your host, Kristi Hujik, and officially here to kick off Season 3 with a wealth of knowledge from someone I follow and listen to religiously. Today on the podcast, we're joined by Dr. Perry Nickelston, a chiropractic physician with nearly 30 years of experience helping people overcome chronic pain and inflammation. He is the founder of Stop Chasing Pain, an international speaker, and the creator of the Self-Care for Chronic Pain Mojo seminars. After healing from a severe back injury and autoimmune disease, Dr. Perry dedicated his career to teaching people how to regain control of their health through movement, breath, and understanding the body's systems. He is known as the Lymph Doctor, and his message is very clear. If you think lymph isn't important, think again. When I was looking to deep dive on lymphatics, there was only one place to turn. He is the creator of the Big Six. You will learn why you should add that to your daily routine by the end of this podcast. Dr. Perry is also an expert in functional movement, performance enhancement, and metabolic fitness nutrition. Plus, he uses cutting-edge tools like Class 4 deep tissue laser therapy to accelerate the body's natural healing process. With decades of clinical experience and a story to tell distilled into easy-to-follow programs, Dr. Perry is always looking to empower and educate. His passion is contagious, and you're going to get so much out of this conversation. Dr. Perry, truly an honor to have you here, and welcome to the podcast.
Thank you so very much. I'm grateful to be here. Thank you so much for asking. And I love the name of the podcast, Ripple Effect. Man, that really applies to health, right?
Definitely does. That's where it came from. It came from my schooling as a health coach. It was something we talked about health coaches making a ripple effect in the world.
Yeah.
So how this kind of goes is that I find the people that have influenced me the most. Why would I just tell them what you said? I'd rather you tell them what you know and what I've learned from you. So I always start the podcast by asking everyone their why. So why do you do what you do, and what led you to this kind of work?
That's a great question. It may be a common theme that you'll hear. And mine was suffering, my own suffering, but oftentimes it can be because you have a loved one in your life that's suffering and you're tired of suffering or they're tired of suffering. And you eventually find out that you likely have to rescue yourself along this journey after you've tried everything that's supposed to work and it doesn't work. And I've always been that way, to ask the question of, well, why am I not healing? Why am I not getting better when I'm supposed to be getting better from everything? There's got to be a reason. And that's where my work came from, because I'm still here. So obviously I was able to rescue myself, but then I also realized there's a lot of other people out there that are what I call in the abyss or the darkness or the quicksand, and they're really trying everything. And I said, well, let me see if I can help them with what helped me. And then that's what brought me here.
Yeah, there's so much that goes into your work. And I know, like you said, we're all here because we had experiences that led us to this kind of work. What from those experiences did you then impart to create your philosophy on healing?
That's a really great question. Part of it is in my name, Stop Chasing Pain. This is a really interesting journey. So I've been practicing healthcare for like 30 years. And I started off in chiropractic medicine as a chiropractic physician and helping people with the usual stuff like musculoskeletal injuries, pain. I did a lot in the sports world, and I did movement-based therapies and then dabbled into, myofascial work and then some neural rehab, things like that. And things were going really good. Yeah. And Stop Chasing Pain came from the philosophy of, I'm treating everybody at their site of pain, but it's not staying better. Like, what's up with that? And I'm treating it with like everything you could possibly think of, right? So let's give you an example, like lower backs. You see lower backs a lot. And I'm like, people shouldn't have to come and see me 3 times a week for the rest of their life for their lower back to take hold. So then I stopped chasing pain and I started to look at other places besides the lower back. So in this case, it would be, let me see how your hips are moving. Let me see how your thoracic spine is moving. What are your feet doing? And I made some great progress. I'm like, holy cow, the body is actually really connected, and you can have, I don't like to use the word dysfunction, but you can have something not working optimum in one place, and then you feel it in another because of the compensation, right? But here's the thing. I was still stuck in a more of a musculoskeletal box approach. I was dealing with muscle and fascia and ligaments. And yeah, I mean, I was dealing with some of the inflammation part as well. But then the universe has a way of like leading you down a pathway on stuff that you're supposed to find it. And you wouldn't normally find it voluntarily unless you kind of get crushed and you have the suffering, because it forces you to see things with new eyes. I ended up getting like a lot of systemic full body infections, like autoimmune type things. Everything you could possibly think of on me started to hurt and bizarre symptoms. And they said, you just got all these autoimmune things going on. And people say, well, what was the diagnosis? I really didn't get one, but it felt like I could be honestly having every one of them. And everything that I knew to do to help myself up to that point from my old lens wasn't working. And then I had to go down more of a Western approach because I had to get some surgeries and medications, and then some were necessary, some were not, but they were trying to help me through their lens. And I was still struggling. And I'm like, I'm getting worse. I'm not getting better. Everybody was trying to help me, but nobody could figure out the answer. And I hit a special form of rock bottom. I mean, I was hanging on by like one thread. And that moment you have to say, okay, are you going to give up or are you going to go forward? So I went forward. I said, now I'm going to have to figure this out on my own. This is what I have to do. I have to think in a completely different way that may look nuts to everybody else. And I had to, because everybody else was looking at it and I was still in the same spot. And that's when I began to look at all the different systems of the body, not just the musculoskeletal system, but I looked at the immune system in particular, because I had an immune system issue. And then I said, well, what's the biggest part of the immune system that I'm not paying any attention to? And then that's when I came across the work of lymphatics that I do now. It's probably about 12 years ago, before anybody was even talking about lymphatics. And not a single soul mentioned that word to me on my journey. And even I didn't think to look at it, because I'm like, what am I looking at lymphatics for? I don't have a lymph problem. Boy, was I wrong. Then when I started to work on that system and then piece all these other things together, guess what happened? Within 30 days, I was a different person, mentally, physically, emotionally. Just about every symptom that I had went bye-bye and was gone. Awesome. And I'm like, okay, I'm on to something. And now what I do is, yes, I teach about the lymphatic system because everybody needs to look at it for everything no matter what. But I look at a multi-systems approach to the body, not just going after one part, one piece, or one system. I look at it all.
Yeah. And I've gotten a taste of that, in my own journey. And that's kind of what led me to you, is that's where I was. And I would say how I came across you was I worked for Dr. Will Cole as a health coach in his autoimmune program, and we were directing people to lymphatic drainage techniques and directing them to your big six, directing them to your YouTube video. So everyone knows Dr. Perry is called the Lymph Doctor for a reason. And so we had that video linked. It's so simple. And it was something that I hadn't dug into. And knowing my personality, I am like, and there's a lot of people listening to this podcast that know me and know that when I find something that I really want to dig into, I really try to cover all my bases and learn as much. And I'm going to take, I think, one of your Mojo courses now that I've lessened my workload. I can have some time. I really do want to take one of your Mojo courses too. But it led me down that path. And for me, I thought lymphatics, I just kind of associated with that. Yeah, I've heard of, I know what lymph nodes are. I know anatomy. And it really was associated more with cancer, but not with everyday operation. Mm-hmm. So I feel like, can you break down for people who might be like I was hearing about this for the first time? Can you break down what the lymphatic system actually does and why it's so critical for overall health?
Yeah, I'd be happy to. And I was the same place you are. So honestly, I can't fault other people because I didn't focus on it either until I had to. Right. And then now it's the first thing that I look at on everyone because I know most people haven't looked at it. Because I treat chronic pain patients, chronic disease patients, let me kind of put this in context and I'll answer your question, is that people usually end up seeing me last. They've been through a lot of everything up to that point, but they're still struggling. So automatically from that first approach, I have to think differently than anybody else's, look at something nobody else has looked at. Otherwise, you wouldn't be there asking me for help because you would already be better. Does that make sense?
Yep, totally.
So I look at the inflammation. Chronic inflammation is the thing that's taking people out. That's what it is. So then you have to see, well, I mean, what part of the body handles inflammation? That's a logical next question. And the answer is your lymphatic system. So your lymphatic system is the primary component of your immune system. Its job is to trap things and scan them like little coders to tell your immune system what it is that they trapped. So they know what to send out to kill it and then eat it and get rid of it so you can go back to living again and you're like, been there, done that, I'm good, I'm okay from my sickness. And they eliminate waste, all sorts of waste. The biggest waste that I look at is your own metabolic cellular waste. It's a really, really important thing here that's going to come into play as we keep talking. So when stuff dies inside of your body, it's got to get out. And if it doesn't get out, it stays inside of you. And that's not going to work out well for you in the inflammation department because you're going to keep staying inflamed because you've got stuff that's in there that's not supposed to get out there. So when they get trapped and they kill it, they need to be able to move from one node to the next node to make their way out of the system, primarily through urination. You pee most of it out, okay? If the lymph gets stagnated and doesn't move well or optimally, then inflammation stays. So it's a huge part of your immune system. And most of your lymphatics are located in your gut because most of your immune system is located in your gut. So if you have a gut issue, which if you have an autoimmune disease, the likely answer is yes, of some type, then you automatically have a lymph issue. They always go together. And then this is when I tell people, how do you know which one came first? To me, it doesn't matter. The answer is yes. I work with both. But the biggest missing component is nobody's releasing the lymph in the gut, right? So you need to do that in conjunction with your nutrition and your supplements. And then, holy cow, everything makes sense, which is kind of what I'll tie into later of why I kind of hit a wall in my work where I couldn't get better beyond a certain point. So it's, to me, the number one system to control inflammation in the body, remove waste, help get rid of swelling and edema. The other one that many people maybe don't know or they don't discuss, it is a huge component of your vascular system, your circulatory system, because it's a fluid system like your vascular system, but your lymphatics will dump into the veins of the body, and then the veins of the body will eventually go into the arterial system. So this is constant connection loop all throughout the body. And what I find is this: people who have chronic pain and chronic inflammation, they have stagnated lymphatics and poor vascular blood flow.
In your course of saying this, we already established the autoimmune people, but like I'm saying, like, to me, once I hear about lymph, like, there's not a person on the planet that shouldn't be doing this.
I'll agree with you on that one. That's true. And then this is when people ask me what kind of conditions or what kind of symptoms that you can have. My tongue-in-cheek answer is yes. Like, honestly, anyone and all of them. The more crazy they are, like you feel like you're almost a pinball machine. I get this, it hurts here, hurts there, hurts here. Lymph's going to be on the table. If you have chronic inflammation, that's going to cause that chronic disease. So once again, when you hear the word inflammation, the next word should be lymphatics. So here's the thing. When you get chronic inflammation, you can get a different disease diagnosis label than another person, even though the same cause is underlying inflammation. It's just manifested differently for person A as opposed to person B. I go after the lymphatics the same because I know they're the fundamental piece of the puzzle. So one of the biggest things that you'll have when I tell people is brain fog is high on the list. Chronic pain, which is different than like acute pain. Chronic pain is something that, for me, is around 8 to 12 weeks and it hasn't gone away. There's absolutely a vascular component to that, without question. And then now you cannot have a vascular component without a lymphatic component. It's physiologically impossible. But here's what I want people to know, is that you have to take that concept and look beyond the side of pain. So if I went back now through the lower back, I was doing a lot of isolated stuff to the lower back to try to help it get better. And when I do that, I'm influencing blood flow and lymph flow. Would you agree with that?
I would agree with that.
When you do anything to a piece of the body, you are changing that. But here's the problem. You're changing it in an isolated region.
You're not creating flow throughout the whole body.
Yeah, it's isolated flow, and that doesn't happen in the body. You have to look at the bigger picture. And then I started to extrapolate. Holy cow. If you have chronic lower back pain, what's on the exact opposite side of the lower back?
The gut, stomach.
Your gut, right? And then what sits there? Most of your lymphatics and most of your blood flow should reside there. But if you've got poor blood flow and poor lymphatics, then that area gets really tense and tight, inflammation, swelling, fascial tension, and then you'll feel it in the backside.
I even feel that with when I have my fascia worked on in the gut. I feel it in the back. It travels. You feel it, like sometimes when he works on my gut, even in the fascia, I'll feel it in my shoulder up here. Because people also don't realize the pulling and the way that everything is so connected until you start to do these things. And then you realize, like you said, the Western medicine way is to look at something in isolation, unfortunately. You go to a shoulder. I had shoulder surgery when I was an athlete. And I think to myself, would I have needed shoulder surgery if someone addressed my neck? Would that have even been needed? If someone did that, would my hip or knee problems have been an issue if someone looked up the chain or down the chain? So I think it's really important, but I think you can really help people talk about the body as a system and understanding that flow and energy and all of that being able to go through without a block is so critical to health.
It really is. And one of the things I had to do was this. I had to go back to basics. I'm like absolute fundamental basics. And I went to read biological books, cell physiology books, and fundamental physiology books to see, okay, what does it take for one cell to heal itself and one cell to regenerate itself? Because if I can figure out how one works, I'm pretty sure it's a similar situation for the other trillion, even though you're going to call them different names, like your foot cell and your liver cell. To me, cells, just different location, same body. And then I said, okay, I got this individual cell inside the body. It needs to get nutrients. It needs from what you eat, and it definitely needs oxygen, right? And I'm like, okay, so it needs nutrients and oxygen. Then I say, how does that nutrient or that oxygen molecule get physically to the cell? Like, how does it get there? And then I thought, that's a really good question. And the answer was fluid. It gets there through the blood, but the blood eventually ends at a capillary. And then you have the cell sitting all the way out here, and it's encased in its own fluid known as the interstitial fluid. And the interstitial fluid is cleaned by the lymphatic fluid, by the lymphatics. So the lymphatics clean the fluid around your cells. So if the lymphatic system works well, that fluid can stay optimal and clean. So when the nutrients leave the blood, they can cross the interstitial fluid and get to the cell. Does that make sense?
Totally does, yes.
So what I'm telling you is if your lymphatic system is a hot mess, that's not happening well, which means that I don't care how many breathing exercises you do or how many nutrients or supplements you take, they're going to struggle if they can't even reach the target that you're trying to reach.
Yeah.
Right?
So it would go back to this. It would go back to...
That's a fundamental. Okay. Then let's say that actually happens. Then the cell takes all of that and it goes through an energetic cycle known as the Krebs cycle. ATP, electron transport chain. That's how you create energy so you can make new cells that work, heal, recover, regenerate. So whenever you make energy through metabolism, what do you always make? Waste. And then here's the next question. Where does the waste go? It goes back into the same fluid, the interstitial fluid. And then that's the waste that has to get out.
And it's got to move to get out.
Yeah. And the lymphatics are going to bring it out.
Right.
The lymphatics, that's the big transporter. And it takes it from one node to the next node to the next node. Those are lymph nodes. They're mini toilets, the flush waste. You got about 700 of them in your body. The majority of them live around the big 6 places that I teach people to work. That's why you work those areas primarily. And then you get waste out and nutrients in. It's so fundamental, it's almost stupid. That everything that I do with my therapy is along that line to make sure that I can get the waste out and the flow to something. I was doing that all along, like I said before, but I wasn't thinking through that lens. I was just thinking of like a localized thing, not the full body. So that's why people do so well when they do the big 6 release, or they open up these things that are, Doc, why are you working over here? My pain's in my foot. And then you do this and they say, Doc, that's the craziest thing in the world. But you know what? My foot actually feels better. And I'm like, I know it does.
We're going to link up the big 6 so that people who hear this can actually see how simple this is. And I also think people become resistant to lymphatic massage, say, because they feel like there's nothing being done. Because it's not deep tissue. It's not even a Swedish massage. Like, people just don't understand how actually simple it is to move lymph when done properly. So can you give them a little bit of a Cliff Notes version here of what else you recommend besides the big 6 that they can be doing? Like, what are some of your best methods? Like, we hear about dry brushing. I'll go to my grave saying dry brushing by itself is not enough. Is that something you would agree with?
Yeah, it's a great start, but it's not enough. And please don't start dry brushing in your feet and work up. That's the wrong way to do it. You can do that after you do the big 6. I got no problem with that. But do your big 6 first and then brush, and you're going to go, Doc, that I can't tell you how much of a difference that made. That's just based on pressure. So big 6, that being said, should always comes first because it opened up the flow route. And the other things that people could do are really, really simple things. One, lymph is like 96% water. So if you're dehydrated, your lymphatic system and your vascular system are going to take a big hit because blood is like 70% water. You're never going to get healthy or well if you're dehydrated. That's a huge one. Even if you do my big 6, all right? So hydrate, and then go down the rabbit hole of what that means, because that's endless too. But just know that look into hydration. The other one is breathing. Just do better, more optimal breathing, because breathing one thing changes pressure in the body. That's the thing I want you to know. Breathing changes pressure in the body. And when you get better at breathing, you'll get better at optimizing pressure. So why does that matter? Because pressure moves fluids, and we do not want fluid stagnation. We want to move the lymphatics, and I want to move the veins, and I want to move the fluid around the brain and the spinal cord called the cerebrospinal fluid, and that moves through breathing. If you can do that, you'll automatically improve lymphatic function. And the other one is just moving more of yourself more often in more ways, differently than you're doing now. That's why I like very simple things of just jumping up and down in place. Simple rebounding works great. Shaking off your different body parts, and easy things like walking, because that pumps the muscle, and then the muscle pumps the fluid, and then the fluid begins to move, and then that's the circulation of life that you do. And I like jumping up and down because it's a novel movement, which means people don't normally do that. And it works great because you'll feel your organs moving in there like almost like a snow globe that you just shook up, and everything is sloshing around. So if you do the big 6 and then you jump up and down, stuff really, really gets moving. I've been doing stuff for 30 years, and I can tell you that one of the reasons that people are suffering so much is because they're overlooking the basics and the fundamentals that they simply don't do on a consistent basis. But many people don't know, honestly, what the basics are. Like, you can't change the lymph until you learn about lymph. So just the awareness of doing lymphatics automatically changes your life. Then you have to find the best one that works for you. I'm going to tell you a game changer will be the Big Six approach, because our stuff is different than a lot of people's approaches from what we do, because ours is based a lot on, first of all, more pressure than what they're used to. But it's really based on the physics of fluid flow called hydrodynamics and hydraulics. That's why the Big Six works so well. And even though it looks really, really simple, that like, doc, you're kidding me, right? No, I'm telling you it works because that's how physics works. And effective things don't have to be complicated. They really, really don't.
Yeah, I mean, literally, that I swear it's been the hurdle. I've heard so many people say it, like with lymphatic massage, like, well, I don't know what I just paid for. Like it didn't feel like it was doing anything. I once asked you this question on Instagram. How do I know that the lymphatic system is moving and things are going well? And you said, you always know when it's not.
Mm-hmm.
So if someone is working on this, how long does it take to feel the benefits? Can they feel the benefits right away? Like you said, 30 days was like a kind of an epiphany in 30 days for you. Is that, something someone should expect? They're going to want results because, everyone wants results now, right? So what should they expect when they start working on this?
That's a great question. We have to keep it in context. It depends on who you're talking about. So if you have like an autoimmune disease and chronic inflammation, it's going to take you longer to get back where you need to go because you have to do this approach slower, okay? Because that means you've been trapped full of inflammation, and I call it muck. Muck is just a general term for waste because I don't care what it is. This has been stuck for a long time, and it's going to take a while to get out, and you will likely feel worse before you get better. Because when you open up these things that have been stuck for a long time, the immune system will wake up and it'll bag it and tag it because now it's been released and it's got to get out. But that's normal. That's what you want. You don't want that stuff staying inside of you. So just be prepared that you'll usually feel worse before you get better. That means that you're on the right track, to be honest with you. Right. People will I've had people notice a huge shift in how they feel with sometimes one application. At most, it will take you about 30 days before you start to notice something when you do the Big Six. But I also have to tell people this: Big Six is just step one. Like there's other depths that you can go to in lymphatics. So for instance, we specialize in working what they call deep central lymphatics. These are the lymph that run deep along the spine itself and the organs. So we have to go pretty deep inside and open up these blocks through special pressure release techniques. And when you open up those, the other ones that are more superficial flow much better because the deeper pipes have been opened up. That's like saying that you've got a clogged toilet, for instance. Sometimes you can unclog the toilet and things flow, like when you do the Big Six. But sometimes you may have like a septic system or something it's clogged at the actual street or at the septic, that you've got to go and get in there and get that out. Then all the other ones can now flow. So that's what I usually find in my work. If you find me, your deep lymph is definitely impacted. You can't get to where you are with those type of labels or diagnoses unless they are.
Right. We need to clone you and have one of you in every state. I'm from Connecticut. I'm like, man, I could go up and visit home and go visit Dr. Perry. He would be able to help. I would also wonder and ask this question. Logically, my brain would say that the other thing that helps lymph is doing some of the daily habits that work against that, which in this society and day and age is probably the amount of sitting that's done. I would guess sitting is detrimental. Sitting long hours is detrimental to the lymphatic system. Is that correct?
Yeah, sitting is a form of its own stagnation, right? And if you think about sitting, you are compressing everything, particularly your joints. When you sit, all the joints bend on each other, and that's the locations of the Big Six when we teach them. So a lot of people have the stagnation, for instance, behind both knees. That's a big place. Then the other one is the crease of the groin. So if you're sitting all the time, the groin gets really, really tight. And if you look at how people sit these days, I mean, they slouch over and slump. A massive tension in the abdominal region. Like you physiologically choke off, blood flow in, blood flow out, and lymphatics, and day after day, week after week, year after year. That's the person who, hey, yesterday I was feeling pretty good, and today I've got an issue. What's up with that? It seemingly pops out of nowhere, but that's not the way it works. So there's a big difference in the treatment approach between like an acute traumatic injury, which Western medicine is awesome at. Like I always tell people, if you get stabbed in your abdomen, it's not lymph time. It's you go and you get that fixed up, but you better do lymph stuff afterwards. But if you wake up one day and then you've got a lot of abdominal issues here and you didn't yesterday and you're like, hey, there's no knife here, that's a different approach. And so you can't treat them the same way. One of the things that I tell people is that it's the state of your vascular system and your lymphatic system before an injury or trauma that will determine how well you recover from that injury or trauma. That's the difference between person A, who gets the same surgery as you, but you get better and they don't. What's the difference? Well, it's the state of the body before the surgery was done to it. That's why these things you want to do ahead of time. And the tricky thing about lymphatic issues and vascular issues that you learn when you study physiology, they have a long latency period between when you develop symptoms as to when they have a problem. What does that mean? You can have a problem in there for months or years before the symptoms show up.
I think that was me.
Yeah. And then I'll say, why is that? Well, because the body's doing its job. It's compensating and doing adaptation to try to heal you so you don't feel pain. Because it doesn't want to hurt any more than you do. But when you feel pain, you automatically know what? All the other options are off the table. That's when pain shows up. So I really make this simple for people. If you have chronic pain, you have an autoimmune disease, you have one, a dysregulated nervous system, and you've been stuck in fight or flight for years. Two, you have poor vascularization and blood flow, likely hypoxia, which is low oxygen, and tissues can't heal, and you have lymph stagnation. So if I can do these three things, take you out of fight or flight, move your blood, move your lymph, you're going to notice an improvement. You're going to feel better. And here's the thing that I learned as well. When you have poor lymphatic flow and poor blood flow, that can keep you stuck in fight or flight.
Yep. They affect each other, no doubt.
Yes, so that's the missing component when people see me is because they're doing all these different techniques to get out of fight or flight, vagus nerve work, breathing work, somatics, meditation. I'm like, wonderful, perfect, I love that. Has anybody done your blood flow and your lymph? No. Well, guess what time it is? It's Big Six time. That's what that is.
Yeah.
Because now you get both ends of the spectrum, and then that's the combination.
Where does vibration plate work in this? Do you see that as being a benefit at all, or do you see that being a tool? I have one at home, and see if you think this is like a decent routine. Like I have a standing desk, so I'm not sitting as much as I was, because I do think I can attest to that. It is detrimental. I take more breaks. When I do those breaks, I'm kind of doing something like you're saying. I'm either shaking out, I'm going up, I'm down on my toes, or sometimes it's 2 to 3 minutes on the vibration plate. I've got a rebounder, on my back porch. So I try to do definitely in the morning. I think lymph flow, right, important when you wake up in the morning. So I do some in the morning.
That's an optimal time for sure,
right.
Yeah.
Right. So maybe is it good to do this throughout, like the Big Six? To me, I do it in the morning and the evening. Does that make sense? Like for a routine, like I'm trying to give them a simple, maybe routine to do during the day so that it's not really just, once a day is good, but there's always a good, better, best. So I was trying to figure out, could we give them a little bit of a sense of a good routine to follow through the day to kind of keep this momentum going when they're working on this?
Yeah, that's a common question that I get and say, hey, doc, is there a better time of the day to do the Big Six? And I usually say, whatever time you're going to do it. I just
Yep.
want you to squeeze it in. Now, that being said, in the morning, you'll find is an optimal time because you've had a long period of inactivity at night, and the lymphatics get pretty stagnated at night because you're not moving. And many people also have poor breathing patterns at night. And so they're not even using their diaphragm muscle optimally because they may be breathing with their mouth open, which will destroy you. All right. So your two primary mechanisms of moving lymphatics, the breathing and movement, are off. And so when you wake up, you're very tight, sometimes very stiff. That's a sign of lymph stagnation in the morning. I would do the big 6 when you first get rolling. Some people like to do it at night because it gets their body open for stuff to flush out at night, because the brain is supposed to flush its toxins out at night when you sleep. But here's the thing that people need to know. It flushes it to the lymph nodes. So if you're stuck at the lymph nodes, your brain's going to be in trouble. And some people do it at night and they feel great. So what I tell them is that do both and see which one your body likes, right? You can do it more than once a day if you like. Some people don't do well with more than once because it's too much of a release for them. So that's the context that I said. 1 to 2 times a day is ideal. It's really great to do before you're going to do strenuous exercise or movement, because you get your blood flow going in all the joints. You get your lymph flow going in all the joints. And with the big 6 technique, you rub and slap and tap your joints. So now you have better proprioceptive awareness of your primary joints before you move, so you'll move better and more efficiently without a chance of injury because you just slapped your joints.
Yeah.
So now your nervous system moves better at the same time. Vibration plates, I love. I use them myself all the time. The only caveat I tell people is try to do your big 6 first, immediately before it, or sometime during the day before the plate, which means that you could do the big 6 in the morning, then do your plate later in the day. The reason being is that when you jump on the plate, it's like a snow globe. You shake everything up. Sometimes those blocks are too intense that the vibration plate is not enough to dislodge the clusters of the lymph nodes that are stuck. So vibration will move it around, but sometimes they can still be stuck. So that's why you do the big 6 first, to open up the big lymph node clusters. Then you shake up the globe, because you need to make sure that everything can still move once you're shaking it up. The other caveat I see is that people jump into too long and too fast on a vibration when they begin it. I say lower speeds, lower time initially, because you can absolutely overstimulate your nervous system with the vibration plate.
Yeah. Great advice. Thank you for clearing some of that up and giving them a roadmap. One more question before I let them know how to get in touch with you and how to follow everything that you do. One of my favorite things that I do hear you say, and it's related to everything we've been talking about, is that pain isn't the problem, it's the signal, right? So for those out there, and I know they will be, feeling discouraged by chronic pain or health struggles, what words of encouragement would you leave them with?
Yeah, another great question. Well, your relationship to pain is everything, right? My favorite way to look at pain is pain is always protective. It's never a punishment. It's really hard to acknowledge that sometimes when you're stuck with it all the time. Pain is simply telling you to change something. And then this is when people say, change what? And I'm like, I don't know the answer to that, but I know a great start. 1, reframe pain as protective, not punishment. That's a good first one. That'll put you more into a feeling of safety, which can make you feel better from pain automatically. The other one is do your lymphatics, do your diaphragm breathing, do your vibration, do those on a consistent basis like that. And then you'll start to notice some of the changes that you want to have in your life. So remember that your body doesn't want to be hurting any more than you do. Pain is kind of the last thing to show up to say, listen, I've been trying to do this on my own, but I can't do it anymore. I need your help. And then this is when you need to be very, very strategic. And the longer you treat the side of pain and it's not getting better, the more you know it's somewhere else. And a good place to start are your lymphatics.
That was so well put. I love that. Pain is Pain is protective. I do love that, because that's what we're talking to people about all the time. And what I do too is like, these are signals from your body. Your body is telling you something. These signals from your body are just trying to communicate with you. Now, lastly, I want to give you an opportunity to promote all that you do. There's a lot, I know, but give them the ways that they can tap into your knowledge, because I do it on a daily basis. So give them all the ways that they can connect with you.
Thank you. And I had a great time. It's very easy to find some of the work that I do. I've been doing it for a long period of time. StopChasingPain.com is the central hub for everything. We have so many courses that you can choose from. We have membership sites. I have my own podcast we were talking about earlier for 15 years, the Stop Chasing Pain podcast, on all the major formats. And I've shared many free content platforms for years. Instagram and YouTube are probably my top two that I spend the most time on. If you go into YouTube and just start checking out some of those videos, you'll begin to notice some changes in your life for sure.
We could have done a whole entire podcast on diaphragm and diaphragmatic breathing and all of that too, but I tried to keep it focused to the lymph. So I so appreciate you coming on and taking the time for us today.
Thank you.
If you enjoy the podcast, I'd love to hear from you. Connect with me on social media. I'm at Whole Health Kristi on Instagram, Facebook, and TikTok. Let me know what resonated with you or what you want to hear in the future. You can always find full show notes and past episodes at kristihujik.com/podcast. Please take a moment to like, follow, review, and always share the podcast with anyone who might benefit. A quick review on Apple Podcasts goes a long way in helping me bring more of these amazing guests your way. Stay tuned for the next episode of Ripple Effect Connection. Together, let's create waves of change.